Yeah.
The broadcast is now starting. All attendees are in listen-only mode.
Hi, everybody. This is Alana Puffinger from UCSF, as well as Jessica Davidman. We're just going to go ahead and give people a few more minutes to log on, but I project we'll be starting within the next couple minutes. So just hold tight. Thank you. All right, everyone, we're just going to go ahead and get started with today's webinar, which is PSE implementation and strategies in action, with the specific focus area on structured physical activity. Before we get into today's presenters, I just wanted to take a couple moments to go over a few announcements. First, we will be using the PSE playbook. We'll be referencing the PSE playbook throughout today's webinar. So for individuals who do not have a copy of the playbook and would like to get one of the most recent versions, please go ahead and send an email to Jessica Davidman, whose information is there, and we can go ahead and get one distributed to you. I also wanted, this is for the Champion Provider Fellows as well as some of the local health departments. So we have added a new work in progress call with Dr. Alicia Fernandez for July 17th, which is a Tuesday from 12:15 to 1:15. So this call is specifically for Champion Provider Fellows, and we'll be sending out invites to everybody with the save the date. We will also be hosting another PSE implementation webinar on August 21st, which will have a different focus area, and we'll be letting you guys know what that focus area will be. It will be one of the 5 areas that is highlighted in our playbook. If anybody has a specific area that you'd like us to focus in on for that presentation, please let us know, and we will try our best to accommodate that request. And then also, we will be hosting a media training on September 11th in Oakland, California at the California Endowment. This training is also for Champion Provider Fellows only. There are only a couple limited spots available. So again, if you are interested in registering for that training, please go ahead and contact Jessica Davidman. That training will be hosted by Brown Miller Communications. And then a final plug to all the Champion Provider Fellows from cohort number 2, which are those that were onboarded in May of 2017. If you haven't already, we request that you please take a moment to finish the quarterly activity report that was sent out via Qualtrics, and you should have received a couple reminders to complete that. We do have some specific questions related to your participation in the program over the past 12 months that we would really appreciate your responses on. So when you have a moment, please go ahead and complete that. So those are all the announcements I have. I am going to go ahead and switch the presenters over to Melissa Peters from ChangeLab Solutions, who will be leading today's call. Just briefly, I wanted to take a moment to introduce Melissa. Melissa is a policy analyst at ChangeLab Solutions, where she works to support agencies and communities working on policy issues related to tobacco control, childhood obesity, and community planning. Before joining ChangeLab Solutions, she worked as a health education specialist for the San Luis Obispo Tobacco Control Program, where she focused on community advocacy, developed tools and resources, and assisted jurisdictions interested in tobacco policy adoption. She also served as a research coordinator for UC San Francisco, where she supported qualitative research projects seeking to understand patient and physician use and knowledge of lung cancer screening. She has her BS in psychology from Cal Poly San Luis Obispo and her MPH in community health education from San Francisco State University. And in addition to Melissa, we also have some fabulous presenters that she will be introducing later on in the presentation. So without further ado, we will go ahead and let Melissa move forward.
Great. Thank you very much, Alana, for the wonderful introduction. Welcome, everybody. As Alana mentioned, my name is Melissa Peters. I'm a policy analyst here at ChangeLab Solutions. I focus on strategies in the retail environment, mainly in tobacco control, but I also hold a lot of the policy systems and environmental change work here at ChangeLab, and I'm really excited to be here with you all today. So let's dive right in. So a little bit about ChangeLab Solutions for those that are unfamiliar with our work. We are a nonprofit located in Oakland, California. We focus on helping organizations, local health departments, nonprofits, policymakers look at laws and policies for the better good of the communities. Mainly focusing on health, we have 4 main kind of portfolios: tobacco control, healthy housing, obesity prevention, and equity. And we work with communities where they are, helping draft model policies and giving technical assistance related to that work. So that's a little bit about ChangeLab Solutions. As a disclaimer, because we do work on law and policy here at ChangeLab Solutions, we are not lawyers, and we are not your lawyer. We don't enter into any attorney-client relationships. And so we do provide advice and consultation related to law and policy, but we don't provide any strict legal advice to any of the organizations that we support. So the agenda for this webinar today, as was touched upon by Alana, we're going to give a brief overview and reintroduction to some of the PSE playbook implementation strategies that were new in this version released a couple of months ago. And then we're going to talk a little bit about structured physical activity. What are the ways we can engage in structured physical activity at the local level, and what ways could local health departments and champion providers partner together on strategies to support that in their communities. And then we have 2 really wonderful presenters in the last half of our presentation. Dr. Nushin Razani from UCSF Benioff Children's Hospital in Oakland, and Dr. Sini Cho from the Contra Costa Regional Medical Center in Contra Costa, talking about their work they're doing at the local level on structured physical activity. At the end, we will have time for Q&A. So if you could type your questions into the chat box, we will be flagging those questions and bringing them out for the presenters or for any of the presenters on the webinar today, and hopefully get your questions answered at the end. Just some housekeeping. As I mentioned, we'll be doing the Q&A, so type your questions in the chat box. If you have a specific question for one of the speakers, if you could mention their name in your submission. And as a note, everybody will be muted for the remainder of the webinar. So the Q&A and the chat box are the way that you can interact with us as we move through the webinar. So PSE, as champion providers and local health departments, you might have heard this framework before, and so I want to do a quick knowledge check and see where people are at on the webinar, how familiar they are with this concept. And so I am going to release a poll question and give you a minute to answer the question to see where we're all at, and go from there. So if you could take a couple minutes to respond to the poll question, and I will give you about 30 seconds or so and see where we're at with the number of people that have already responded. Okay, we have about 50% that have voted. It seems that many are familiar and can recite it in their sleep. That's amazing. And some are familiar but could use a bit of refresher. So why don't we just do a really brief refresher to get everybody on the same page before we move through the rest of the presentation. So I'm going to close the poll. We got a 77% vote rate, which is pretty good. So PSE is a way of looking at changes in local communities from a variety of different levels to help support one common goal. So, for example, policy change at one end of the spectrum involves creation or alteration of formal written statements that govern a community, and then results in a broader change for the whole community by a more mandatory or formal process. A systems change involves maybe an ongoing change that's more informal within a certain organization or system that results in new practices that changes the way that different organizations or different communities interact with each other. It doesn't have to be formal. It can be a shift in internal policy. It can be a shift in the way that a company is doing something that makes it kind of different from a policy change. And then environmental change goes out and actually alters the economic, social, or actual environment that results in a new opportunity or level of access related to the goal. So, for example, all of these changes end up working together to support each other. So, for example, you could adopt a policy that is requiring open access to parks from sunrise to sunset. And a formal policy is passed by the system. That is a policy change, but it does affect the environment of that system. So now the park is open, people have more access. So a policy change impacting an environmental change. So all of these, the policy, systems, and environmental change work together to create a structure of intervention that supports health and change in the community. That's a brief overview of policy, systems, and environmental change. There's a deeper examples of this in the PSE playbook. So if you need a more deeper refresher, I encourage you to go to that resource. And we have a whole section devoted to policy and systems and environmental change. What is it? What are some examples? How do they each differ from each other? So I'd like to move on now to talk about the role that providers can play in policy, systems, and environmental change. And so as physicians, as local health departments, there's no right way for someone to engage in a PSE change or a change at the local community. Both physicians and local health departments are valuable partners in PSE change because of their experience, their knowledge of the populations that they serve, and their roles as respected community members. So working together, both of these providers can provide valuable assets to any sort of change happening at the community level. However, each community is different, so the involvement will also be different. So it's important as we walk through the roles that we've outlined in the PSE playbook that there's no right or wrong answer for anybody in any PSE change, and each role is equally important and really integral to the success of the change at the local level. So the 5 roles that PSE that UCSF and ChangeLab Solutions have identified as what providers could play are the connector, which helps identify resources, really connects groups together, is able to see what one group is missing that could provide to another group. And we've kind of identified that as kind of a low level of involvement, but really integral to getting things connected and moving forward. There's an advocate who can identify a specific policy decision or change and really get out in the community, take that on, be a champion, and talk to the people that need to be talked to about that to make a change. Amplifier, this takes a little bit more time because you're actually, writing op-eds, writing press releases, being interviewed related to the change you're trying to make. And so that's a medium level of involvement. The team expert joins a collaboration and provides that really necessary expert opinion to the group. So it could be a physician is a great role for this type of provider role because they have the expertise, the medical knowledge about what is being said in their visits with their patients, as well as what do they see as a trend with the people they're seeing in the community. Health departments also are really great in this role as well because they see a broader community overview of what's happening and can provide that expert opinion to any type of coalition. And then there's a leader. The leader is a real high level of involvement. They're taking ownership of the change at the local community level. They're identifying resources. They might be writing requests for different people to join. They're out there recruiting. They're establishing partnerships. So they're really taking a leadership role in what they're doing. So I wanted to see, after we've kind of overviewed the different levels and the roles that both healthcare providers at the clinical level and local health departments can play in a PSE change, where does everyone kind of see themselves on the call? So I'm gonna launch another poll question and see where everybody on this call sees themselves in the broad range of PSE. So the poll question is launched. So if you guys could take a couple of minutes to answer that poll. So we have a large majority think they're connectors, but also team experts. We have some advocates. I think the spread of this poll as the results are coming in really show that there is a place for everybody in this kind of level of involvement as well as the roles identified, and that each role, each unique person that comes into a PSE change can add something to the overall success of the work in whatever role they play. So it looks like we have a lot of people think they're connectors, connecting people, advocates. Oh, we have a 4-way tie between connector, advocate, amplifier, and team expert. So that's really great. And we have some leaders on the call. So thank you guys for filling out that poll. I think it gives a broad overview of the different ways people can integrate into a PSE change. So I'm going to close that poll. So now talking about putting ideas into practice, we, in this last PSE playbook, have started a implementation of the 7 elements of PSE change. And I wanted to see how people are familiar with the 7 elements, and that'll determine kind of how much I need to do a real deep overview, or if everybody's familiar, we can kind of do a breeze over it and kind of move on to the next session. So I'm gonna launch one last poll and see how familiar are you with the 7 key elements of PSE change, and where we should focus our time for the rest of the session. So we have some maybes, some yeses. Okay, so it looks like we have a lot of maybes saying that. I'm not sure, could you remind me, but at least everybody has kind of heard of it before. And so why don't we do a brief overview of the 7 elements, and then if you want a deeper understanding or you like to get more information, the PSE playbook has a very broad and deep section on each of these changes. So the 7 elements of implementation of PSE change are: number 1, define the problem and goals. You know, this is answering the question of, close the poll. This is answering the question of, what is the problem I'm trying to address? What do I want to achieve? What's my ultimate goal? So defining the problem sets you up to go through all the rest of the elements. Understanding the PSE landscape. So when you decide on what kind of change you'd like to implement, understanding what else is going on in the environment that you're working in to help really support the PSE work being done in other organizations, because you don't want to duplicate, you want to complement, and you want to be able to collaborate and combine efforts once you understand what other people are doing at the local level. So outlining a clear strategy. This doesn't have to be a 50-page policy strategy document. It could be a 1-page outline of what you intend to do, who you intend to talk to, what resources do you need, and that'll help set up how you're going to go about working on your change. Mobilizing partners, that's number 4. This is where those that see themselves as connectors, connecting people with each other, trying to get people up into the support of the PSE intervention. How do you need to engage policymakers, decision makers, key stakeholders? This is all what you would outline in this particular element. So educating the public and key decision makers. Change isn't going to happen if nobody knows about it. So you want to get out there and educate the public, tell them why the change is important. This is where I think amplifiers play a good role in writing op-eds, doing press releases, having interviews, making sure that people understand the issue and are aware of it. Number 6 is determining whether you've been successful. So once you have the problem identified and your strategy, how do you know when you're going to achieve it? It's really, how do you know when you've achieved it? It's really important to know that so you know what you're working towards. You can also have intermediate success steps to work toward as you go along, which will help your movement forward. And finally, 7 is take stock and level up. Once you've reached one goal or you've reached an intermediate goal, how do you take stock of that? What were your successes? What were your challenges? What would you do differently? And how would you build that up to the next stage? How would you take that to the next level? That's a key element as you want to start building momentum and support for your change and start to move forward. So that is the 7 elements of PSE change, a brief overview just to get people familiar again. And again, a deeper discussion of those are in the PSE playbook. So now I want to talk about some PSE strategies for structured physical activity. I'm going to give some strategies, and then the 2 presenters we have on the call are going to go deeper into another 2 strategies. So there's really 5 strategies on this call, on this webinar, that you're going to get an overview to for what you could do at the local level to work on structured physical activity. So structured physical activity as an intervention is focused on increasing the ability for community members to have access to ways to work on their physical activity and support access to facilities that support physical activity. It is really focused on making physical activity programs more affordable through low-cost or guided exercise classes, team sports, really trying to make sure the access points are there, and making these programs more convenient by existing programs incorporating exercise, activities, working that into the daily operations of programs or organizations to make it more accessible for the people that are attending those programs. And also, structured physical activity work focuses on increasing the number of places that people can be physically active by creating or improving facilities, expanding access to public facilities such as gymnasiums, playgrounds, fields, courts, tracks. And there's 3 ways that I'm going to present that you could work on structured physical activity, and those are shared use, wellness policies, and complete parks. So shared use is one strategy that governments or private organizations can work with public organizations to open their access or for facilities for the public to use. So how that works at the local level is a school, for example, can open their fields open after hours so that a local youth youth organization can come and run their after-school program on their campus. Shared use opportunities can be put in place by non-formal agreements or solidified by formal policy. So like I mentioned before, a school can unlock their gates before or after school, allow indoor or outdoor access to facilities, enter into nonprofit partnerships, for example, with the Y, to host their after-school or summer classes, or agree to reciprocal access agreements, meaning the school will open their grounds for an organization to use, and then that organization will provide something to the school, so they're having a reciprocal agreement. Wellness policies. Wellness policies are also is a written document that you can that a school or other organization or work site can adopt to encourage physical activity. And there's 2 main ways that we at ChangeLab are looking at wellness policies. So schools currently in all local education agencies now are required that receive federal funding are required to have a wellness policy in place. And the wellness policy must address things like physical activity, involve parents and experts in the development of those activities, establish a plan to implement those activities, and inform and update the public regarding those activities. So a way that physicians and local health departments can be engaged in that is contacting the school districts, understanding the wellness policies, and advocating for more physical activity in those. And then organizationally, many adults working at their work sites, they spend a lot of time there, and the workplace can actually play a big role in positive health changes. So worksite wellness policies can include language that encourages physical activity, such as bike to work programs, promotion of walking meetings, paid time for physical activity, and tax credits for active transportation. And the champion providers can all work on those by working with local organizations, talking to them about their wellness policies, and advocating for these changes. The third way that there could be PSE change about physical activity is working on complete parks. So complete parks is an approach to parks that looks at the park as a whole organization, a whole environment in which has many health impacts. So a park is complete to the extent that it integrates into the neighborhood and people's lives. So many parks focuses of the complete parks approach focus on creating safe routes to parks, encouraging equitable access to parks, ensuring parks have community-led activities and programs. Additionally, in support of the complete parks approach, Proposition 68 was just passed in California, and there's now about $725 million set aside for CA neighborhoods that historically did not have great access to parks or did not have access to parks at all in low-income neighborhoods for redevelopment and the park, bringing parks up. California Parks and Rec will be the administrator of that money. And so one way that physicians and local health departments can get engaged in complete parks is really advocating for the health impacts, advocating for the health benefits of parks, and working with the Parks and Rec department to identify the best ways to use that resource, the new resources, to benefit health in the parks in their neighborhood. So a couple of resources to support you, obviously the PSE playbook, which I've mentioned quite a few times, as well as ChangeLab Solutions has some resources related to each of the 3 areas I mentioned about structured physical activity. So we've recently come out with a slew of new resources related to complete parks and the complete parks indicators, which is an assessment tool for reviewing your park system. Walk This Way goes over all the intricacies of worksite wellness policies, and then the benefits of shared use infographic gives some talking points related to shared use, and we also have fact sheets, contracting step-by-step fact sheets, as well as policy support on how to set up a shared use agreement or a joint use agreement with local organizations. So now I would like to introduce our guest speakers for this webinar. And in this section, we're going to go over how these structured physical activity interventions really work in action at the local level. So 2 of the activities we're going to go over with today are the Park RX program, which fosters a patient and provider relationship where providers talk with patients about how to get an exercise routine and effectively use their neighborhood parks to do fun physical activities most appealing to them. And the second intervention type is Walk with the Doc. In this program, a doctor gives a brief presentation on a health topic and then leads the participants on a walk at their own pace. And so to give you guys an idea of how these are implemented at the local level, I will now hand it over to Dr. Nushin Razani, who is the founder and director of the Center for Nature and Health at UCSF Benioff Children's Hospital. And Dr. Razani is going to give an overview of the SHINE program, Stay Healthy in Nature Every Day, and a little bit about her program and how she implements it, and I will hand it over to her.
Hi, everyone. Thank you, Melissa. So I founded and direct a program called Stay Healthy in Nature Every Day, or SHINE, and it is a program run in partnership between our primary care clinic in our hospital, which is an FQHC, and our regional park district, which is the East Bay Regional Park District. It was founded 4 years ago, and we've gone on monthly park outings plus a few other times. So we've gone more than 60 times into nature. And the indications for referral to the nature outings are stress, loneliness, or physical inactivity, which basically means that all of our patients are eligible to be referred, and anyone in the FQHC can refer to the program. This picture that you see on the right is a picture of Bert Lubin, who was our hospital CEO when the program was started, and Carol Johnson, who is from East Bay Regional Parks District. And it's taken in one of the hallways in our clinic. And it shows a big poster of redwoods. When the park district first came to us and wanted to partner, there was a little bit of pushback from the doctors because we argued that, the reason folks are not outside is not because they lack a prescription from us. And if you want patients to be outside, you should make more nature where they live. But, they were such great partners and they kept listening to us. And so the first thing we said is, please bring nature into our clinics. And so they did. They helped us decorate our clinics with big posters of local nature. And then you'll see right above the big redwood picture, there's a little insert showing some of the maps and pictures that are actually inside each clinic room. And all of our clinical areas have been named after local East Bay Regional Parks, which is really wonderful because it's a prompt to remind people to refer patients to this program. But it's also just, you know, I've had patients look and be like, is that Oakland? Is that where I live? And it's really amazing to let nature do its own advertisement, I guess. So these nature outings happen once a month on a Saturday. And when patients come to clinic, we actually now do a quick clinical visit and vital signs, and then everybody, and we do really short, like maybe 2 minutes of group education, and then we get on a big yellow bus and we go to local parks. And I would say that like there's some science behind what we do there, but really our main goal is for the kids to have a lot of fun and for the parents to have a chance to relax. We eat a meal together, and that decision was really based on the literature coming out of SF State, that picnics and barbecues and chances to be with family are some of the things that really resonate across all cultures in terms of wanting to be outside. And then we do have a light walk, but depending on the age of who's there, we try to be really developmentally appropriate. And over time, it's turned out that more of the 0 to 5 group come on the outing. And so we're super non-linear and unstructured and very sensory based on what we do during that walk. The other things that happen that you know, I didn't quite anticipate, first of all, is that we really wanted the outings to be multi-generational and for children who are prescribed nature to be able to bring their parents or extended family. And so we have some families that have been coming every month for 4 years, and they consider it like a date within their family. And in the upper left-hand corner, you can see one of our patients with his grandfather, and this is like their special time. They come every month. The picture of the child with that cool beach wheelchair, which is awesome, that the East Bay Parks give us, he's been coming every month for the last 4 years. And that's a picture of my son pushing him. And so what's also happened is that the doctors bring their own kids. And first of all, we're always humbled by how much better parents that our patients are than we are. But also, it's just humbling to interact with patients in a setting where they're not, where the power differential isn't so clear as it is in clinic, and they're also in a position of strength. And so some really meaningful friendships have formed. And then on the right-hand corner is where you see that shine picture, and then you see some medical residents and East Bay Regional Parks naturalists. And another thing that's happened is that some of the residents have started coming on our outings, and now the outings are actually integrated into their community rotation in intern year. And then on the lower side, you can see just, you know, even though the target is children, a lot of the parents enjoy, you know, get to experience a little bit of awe and relaxation and fun, which is wonderful. And then in the lower right corner is Morgan, which is one of our residents who actually got a grant to spend the 3 years of his residency working on the program. So we are currently piloting our clinic as a billable clinic. We have the referrals integrated into EMR so that it's just the same as an ortho or other referral. When someone orders it, the MA books them into the monthly clinic, and then the hospital sends them a reminder letter just as if it was any other appointment. We've worked on a SOAP note, and soon we'll be able to share that. We're kind of working through which billing codes to use, but it's been now 2 months that we've been billing for the visits. Our goals are really to make this an insurance reimbursable service, and to find out if there is a model for nature-based clinical care. And really, ultimately, we hope to advocate for access to nature as a health equity issue, and we definitely understand that clinical nature interventions are not necessarily the most effective way to get the most people out into nature, and we'd love to join other physicians in advocating for nature where people live. And I'd love to answer any questions after the next presenter. Thank you.
Thank you, Dr. Azani. That was a great overview of your program. I have just one question for you before we transition into our next presenter. I'd like to know how you've measured success in your program and how do you communicate that success to the community?
So we did do a randomized trial of our program, and this was super early on, and I think it was a success that we even used the words randomized trial, because when we did it, it was really a new idea to not necessarily physical activity, but to actually have a nature prescription program. And so we've communicated those results through peer-reviewed journals, and we got some press around that. And so we've been going to conferences and talking about that. But we're really working on finding a way to evaluate the program moving forward. And there's been challenges in trying to capture the benefits of nature, because really what we're targeting are stress and loneliness, which are things that we don't screen for. Even physical inactivity we don't screen for in our clinic. And I hope that if we find a way to document changes, then we can actually advocate for clinicians screening for these things. A lot of times people don't screen for stress because we don't have anything to give. But if nature is a viable intervention, then more physicians may feel empowered to talk to people about stress. So one thing is the challenge of looking for health outcomes, which is something we're working actively on. And then the other outcome that we use is just attendance and consistency and longevity. And we happen to have about 50 people show up to the outings every month. That took a while to establish, but that's one way that we measure our success. And now that we're able to argue to our own administration that we're actually making money, that's another way that we're measuring success. And of course, that has to be balanced against, how much health benefit is coming. And so we'd love to work with anyone who wants to work with us on finding the right health outcomes to measure.
Great. Thank you very much for your presentation. It's very exciting work that you're doing. And now I'd like to open up the call to Dr. Dini Cho from the Contra Costa County Regional Medical Center, who will be presenting on her Walk with the Doc program. Dr. Cho?
Hi, can you hear me?
We can hear you.
Able to hear? Oh, great. Okay, awesome. Okay. So thanks for inviting me to this webinar. And I want to tell you all that I started doing this because I was completely inspired by Nushin Rusani. So I'm so excited to hear about the latest and greatest of her project. In Contra Costa, we're right next door to Oakland. We're just a couple towns away. And I started doing this work as a way of getting some of our families outdoors as well. I was very interested in parks prescription. And we did a few bus trips similar to what was being done in Oakland, and still is being done in Oakland. And so that was successful, and we're still doing some of those. We do them about 3 or 4 times a year now, and we are having some success. But we realized that in our county, it's a little bit different. We have 8 different clinics in our county. It's Contra Costa. We have is just a large area. So we have West County, Central County, and East County, and it spans easily more than 40 miles across. And people in one side of the county won't be able to participate in a bus trip that's taking place in the other side. So immediately we kind of knew that having an organized trip to certain parks from our clinics was not going to be as feasible, just because of the number of clinics and the wide area that we were talking about in our county. So we started thinking about different models of how to encourage people to get outdoors, and we decided to try something more, I guess, decentralized. So we picked something called Walk with a Dog, which is an existing organization founded by a cardiologist, David Sapgear, in Ohio. And this organization encourages physicians to volunteer and help organize walking groups for patients, and gives them support to do that. There's like liability insurance and kind of waivers that are already created. It's kind of like a package. They have t-shirts and signs that you can use, and they can help you with a website. It seemed to be a service that would be helpful if we're going to start different types of walking groups in different locations. We wanted to support different clinicians across the county to do this. We knew a lot of the doctors here are excited about going outside. We even have a physician who used to be a ranger, and she was really excited about taking walks with her patients. And we also knew from hearing from our patients that they were excited about walking, but they wanted a partner to go with, or they just weren't, it wasn't a routine, or they felt lonely doing it. So in order to provide some of that structure and organization, we thought providing some support, like a toolkit and just a little bit of more organization for the walk leaders, that might help get that going. Now, we just started this within the last 6 months, so I'm definitely not as far along in my project, but I can already say that we're having a little bit of success. We had a couple events, and we do have some walkers, and we have several physicians who are kind of signed up to do walks. We're trying to work out our schedule, and as part of that, we're trying to determine where we should have the walks, what time of day, how far. We did a survey of some of our patients in our group visits, and also of some local community groups. And people, it's fascinating, the results of this survey, because people say they do want to walk, but they need organization support as well. So it's on the patients and community member side too, that everybody is kind of interested, but support is what is lacking. So right now we're in the process of creating our schedule for the walks, and we're going to be advertising our walks to our group visits. We have pediatric obesity group visits and diabetes group visits, and we're going to try and get a regular schedule going for just smaller, kind of less formal events. And we're going to try starting off in our clinics or in school-based clinics to make it more convenient. On that note, we're also trying to figure out where should we start the walks, where should we hold them. In our survey, people said they would enjoy going to regional parks, but actually for regular activity in their local neighborhoods and in local parks would work out better for them. And so we're focusing a little bit more on local neighborhood trails and community parks. So part of that is also working with community groups. We have contacts with several community groups that are already trying to run walks, and they all already have patients or community members recruited who want to go on walks. So we're talking with them about where are the best locations. In fact, for example, in Antioch, California, I talked to the members of the East County Regional Group. It's a parent volunteer group, and they had just renovated a park, and they actually asked me to do the walks in that park. So I'm going to try and work it out where we start at a local school, starting at a school-based clinic. We do a quick talk at the school, and eventually maybe we also will be able to do a group visit and bill for that, and then go for a walk out to this park that has already been renovated by these fantastic volunteers. So, those are some of the things that I've been doing. Maybe next time I can give you guys an update on how it all went. But for now, I'd like to open it up for questions.
Thank you, Dr. Cho. That was a great overview of your program and the different elements that go into that work. I'd like to start off with one question, and then if anyone on the line has any questions for either of the physicians or the presenters on this webinar, if you could start typing those questions into the chat box. We'll be doing a Q&A in a couple minutes. But I'd like to ask you, Dr. Cho, can you talk a little bit about how you've partnered with your local health department, and what were the successes and challenges, some challenges with that partnership?
Sure. So as part of the Champions Providers for Change program, I was introduced to people in my local health department, and I was introduced to Gwen White, and then later she introduced me to Tiffany Bell, who's in the photograph on the left that you see, and they have really helped me with my planning of the walks. For example, Tiffany helped me create the survey and distribute it to community groups in the area. So we're not just asking our patients about what would work out for them. We're also asking people in local, like parents groups, the Latina Center, different organizations. And so we have a little bit of reach in terms of being able to communicate with people, not just in our clinics, but in the rest of the community, and also getting a diverse set of opinions and input into creating this. So I think the Department of Public Health has really helped us out in that way, and they've also come on some of the walks as well. And they are just instrumental in helping us get organized and just, doing crowd control when that is necessary. We did one in the park. The picture on the left is at Kennedy Park, and we had a reservation there. Tiffany actually went, and she got the reserved spot open because someone was already occupying it, and she said, "No, we have this spot reserved," and she actually negotiated with the person, so instead of taking up the whole spot, he actually joined the walk. So that definitely instrumental to be working with the local health department. For future activities, we're thinking about working with school-based clinics, and that is something that is organized through our local health department as well, a different branch of the health department, but they are able to run programs in the schools and run the school-based clinics. And so in order to try any model where we're billing for a walk and we want to start it at school, we're going to try and work with them to make that happen instead of starting off at our clinic. We already kind of understand that the clinic, at least in Antioch, is not in the best location, to start a walk, to have people show up on a regular basis for a walk. In the school is a much better location where more people live. So 2 different days. Yeah.
Great. Thank you. So now, after that, I would like to open it up for questions in the chat box. I do see one question, and this could be maybe for both of the presenters. How often do your walks take place? So why don't we go, Dr. Razzani, if you could answer that first, and then Dr. Cho second.
Hi, this is Nusheen. Our clinic is once a month on the first Saturday of the month, and we thought that we would be remembered better by providers and have to do less provider education if we picked a consistent time and day. I'm not sure that that's the right way to do it because Saturday afternoons don't work for everyone, but that's what we've chosen.
And Dr. Cho?
Hi, so we don't have a full schedule yet. We're doing kind of some larger events every quarter, but we're hoping to get more regular walks at different sites, maybe once a month at least, and as many times if we get more participation as we go along, we could go up to twice a month or even once a week. I do have volunteers who could potentially do that. Great.
Thank you very much. And we have one last question before we wrap up for the day. So this is also for both presenters. Can you describe the liability concerns that you have for group walks in each of the programs? How do you address that? Dr. Cho, do you want to go first?
Oh, sure. Okay, so one of the reasons why I signed up with Walk with the Doc is because they helped me address that concern. We had already been doing walks with our patients outside. I've been taking kids outside for my pediatric obesity group visits, and I was already taking them outside of the clinic, and I was actually not really covered by insurance at that point. And so I really needed to figure out some way that I could get some sort of liability coverage. Walk with the Doc includes general liability when you sign up, and it's not for a particular provider or patient. It's more based on site. So any doctor or any volunteer who's working with you will be covered, as well as the participants. So what's helped is that because of that structure, we're able to have doctors from different organizations participate. One of my colleagues is a Kaiser doctor from Martinez, and she's really excited about doing Walk with the Doc. So she's going to be leading some walks as well as part of this program. So it gives us more flexibility. Yeah, it doesn't cover medical liability, so we really had to make sure that we distinguish the fact that we're not doing a medical visit. This isn't part of anything having to do with the clinic, even though we are kind of starting at a clinic potentially. Some of our patients may be participating. It's separate from that.
Okay, great. And then, thank you. And then Dr. Razani, very quickly, before this will be the last question. Do your families need to sign a waiver to participate in the nature walk?
Yes, so we got around the liability issue by having a waiver that has language for both us and East Bay Regional Parks in it. And then our medical group also requires every physician that participates in the walk to go through a process where we are covered as volunteers on the walk. And then even though we do have a clinical visit associated with the outing, we make it very clear to the patients that what happens in the clinic is the medical part, and then we're volunteers when we're outside.
Okay, great. Thank you for that clarification. So I'd like to thank both of the physicians for coming and presenting on the webinar today and giving an insight to their programs. I want to make sure that the attendees today have contact information for each of the physicians as well as myself. If you have any questions on the content that was presented today or the program, Dr. Razani also provided the website for the Center for Nature and Health at UCSF Benioff Children's Hospital, Oakland, that you can go and click on a little bit more of the projects that she's working on there. And I thank you all for joining us today, and I will hand it back over to Alana and UCSF to close us out.
Yeah, thank you, Melissa, and thank you to Dr. Rosani and Dr. Chow for wonderful presentations. I know there may be some additional questions that individuals have. So again, as Melissa mentioned, we'll make sure to get that information out to you as far as the presenters. We will also, this webinar was recorded, so we will be able to send that out to everybody, as well as provide copies of the slide decks that were presented too. So with that, we'll go ahead and close it out, but thank you all so much for joining us on today's call, and we look forward to being in touch in the future. Thank you again.
Thanks.